This medication is specifically designed to help those with a certain type of cancer called multiple myeloma. Isatuximab is a type of drug known as a monoclonal antibody, and it works by slowing down or even stopping the growth of cancer cells in the body. It is typically administered through an intravenous solution, and the dosage and timing of administration will be determined by your healthcare provider based on your individual needs. Before starting isatuximab, make sure to read the patient information leaflet provided by your pharmacist. This medication is given through a vein by a healthcare professional, following your doctor's treatment schedule. Typically, it is given once a week for the first 4 weeks, and then once every 2 weeks. Be aware that isatuximab may cause serious infusion reactions during or within a day after treatment. Your doctor will prescribe other medications before each treatment to help prevent these side effects. If you experience symptoms such as nausea, shortness of breath, cough, headache, or chills, be sure to inform your doctor immediately. The dosage of isatuximab is determined based on your weight and response to treatment. It's important not to miss any doses in order to get the most benefit from this medication. To help you remember, mark the days on the calendar when you need to receive isatuximab. If you experience diarrhea, nausea, or vomiting, make sure to inform your doctor or pharmacist. It's important to note that while using this medication, you may experience serious side effects. However, your doctor has prescribed this drug because the benefits outweigh the risks. Your doctor will monitor you closely to decrease the risk of serious side effects. Be sure to contact your doctor immediately if you notice any serious side effects such as easy bruising/bleeding, or unusual tiredness. This medication may also lower your ability to fight infections, so be aware of any signs of infection such as a sore throat, fever, or cough. In some cases, people treated with this medication may rarely get other cancers, so it's important to consult your doctor for more details. While rare, a serious allergic reaction to this drug may occur. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using isatuximab, it's important to let your doctor know if you have any allergies or if you've had any recent infections. Isatuximab may increase your risk of getting infections or make current infections worse, so it's best to avoid contact with anyone who has an easily spread infection like chickenpox, COVID-19, measles, or the flu. It's also important to inform your healthcare professional if you are planning to have any immunizations or vaccinations, as isatuximab may affect their effectiveness. And to lower the risk of injury, it's advisable to use caution with sharp objects and avoid activities like contact sports. If you are pregnant or planning to become pregnant, it's crucial to discuss reliable forms of birth control with your doctor, as isatuximab may harm an unborn baby. If you are using isatuximab in combination with pomalidomide, it's especially important to use 2 reliable forms of birth control if you are female, and males must always use a condom during sexual activity. Lastly, it is not recommended to breastfeed while using isatuximab, especially when using it with pomalidomide, due to the potential risk to the infant. Always consult your doctor before making any decisions regarding breastfeeding while using this medication. It's important to be aware of how Isatuximab-Irfc 20 mg per milliliter intravenous solution may interact with other medications, as it could potentially change how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, inform lab personnel and all your doctors that you are using this medication, as it may interfere with certain lab tests, potentially causing false results. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Isatuximab-Irfc 20 mg per milliliter intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important to remember not to share this medication with others. Before starting and while using this medication, you may need to undergo lab and/or medical tests, such as a complete blood count. It's important to keep all medical and lab appointments and consult your doctor for more details. Be sure to take each dose of Isatuximab-Irfc 20 mg per milliliter intravenous solution as directed by your doctor. If you happen to miss a dose, consult with your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. This medication, Isatuximab-Irfc 20 mg per milliliter intravenous solution, is administered in a clinical setting and is not meant to be stored at home. It is used to treat multiple myeloma, a type of cancer that affects plasma cells in the bone marrow. The dosage and frequency of administration will be determined by your healthcare provider based on your individual condition. It is important to follow their instructions carefully and to attend all scheduled appointments for your treatment. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.